see my feet until.
All right, Eugene. So we did our cranial nerves. Let's see. We just got done doing our cranial nerve number 8. So now we're gonna do our. I'm gonna have you stick out your tongue. Okay, I got a little tongue depressor here. You can say ah. Okay, I'm looking at your uvula. Everything looks good. I'm gonna put this tongue depressor. I'm gonna test your gag reflex. Okay, ready? All right, perfect. Your gag reflex is intact. Can you move your tongue up and down, side to side? All right, good, good, good. So, we got our cranial nerves done. I'm gonna look at your scalp. Okay, your scalp is clean and dry. Right. I'm gonna have you pull up your shirt. All right, skin is intact. Looking at your back. All right, skin is intact. Do you mind sticking out your arms like that? Okay, you're gonna press on your fingers, testing for cap refill. It's less than 3 seconds, perfect. Check the skin turgor. Alright, there we go, perfect. And then now I'm gonna check some pulses, okay? Alright, there we go, strong pulses on your radial pulses, okay? And check your carotid right here.
Oh no, we're still going. It's still going.
Alright, good strong pulse. I'm also checking your thyroid right here and lymph nodes. Alright, perfect. It's not swollen. Also, I'm gonna continue with the pulses. So I'm gonna check your, do you want me to check your femoral pulse?
No, thank you.
Alright, I'm gonna check your popliteal pulse down here, and your pedal pulses down there. Alright, perfect, good strong pulses. And now I'm gonna listen to your heart, okay?
We're at the hospital.
So I am actually gonna start on your right side.
Nothing to know, no.
Alright. And can you tell me your name again? I'm so sorry.
Okay, move towards the left.
Mr. Johnson.
Oh, Mr. Johnson. Okay. Sorry, Mr. Johnson. What brings you in today?
So, I've been having some trouble with my right leg and foot recently.
Okay. What's been going on with your right leg and foot?
So, my right calf.
Okay, heart sounds are good.
Okay.
And yesterday
No heart
I
murmurs.
accidentally hit it.
Alright, gonna listen to
hit
your
my
breath
foot
sounds
on the
now,
car door.
okay?
And my heel is hurting too.
Are you able to take some
not
good
just
deep
my
breaths for
foot.
me?
Though my calves and my thighs are very uncomfortable.
In
I think my leg's a little
out,
swollen, and it
okay.
usually doesn't do that.
Don't
And
hold
then
it
my
in too
skin,
long. I don't want
feels
you to
dry,
pass out.
which is normal for me. This
And I'm going from
the flaking isn't.
right to left, and I'm just comparing sides, okay?
It's been like a few days, like 3-4 days.
Perfect, perfect.
And
Alright.
your pain levels at right now on a scale of 0 to 10?
Right now, it's
While
like
I'm doing this, I'm also gonna have you take a deep breath.
Last few days, has it been running
I'm
at
checking
that
for
high level pain?
No,
even
it's been increasing.
It's been increasing? Okay.
rise of the chest and fall.
And have you been taking any
Okay.
medication for it? Have you
And now I'm gonna listen to your
seen
lungs in
any
the
other, like, doctors for
front
it, or
as
is it
well.
No, yeah.
Nice
This is
deep
my first
breaths.
visit.
Good
My
job.
wife,
Good job.
Nancy, and I have been married 65 years. That's what brought me in today. She wanted me to come in. Our son Robert lives.
Lung
500
sounds
miles
are
away, so
clear
she's with us.
bilaterally,
But,
upper and lower
my neighbor,
lobes.
His name is
Okay,
Jim Reynolds. He's my friend.
so,
He checks on us often.
and you said no
I do
shortness
have
of
a
breath right
medication.
now
I
too.
think it starts with an M.
Okay.
Honey, what is it?
No.
Oh, metformin.
I definitely
Okay,
want
so
to check
metformin
out your
is the
leg as
medication I
well,
take.
okay?
And
I'm gonna
then
check your skin.
Oh yeah, it is for my diabetes. Yes. My
pull up
wife
your
handles all my
leg.
medication.
Oh, okay.
Your right leg,
and then I
it
can
is
eat whatever I
red
Okay.
and inflamed.
Oh yeah, because I take the metformin.
Okay.
So
And you do have an ulcer on your foot, multiple ulcers on your legs,
we'll
on your
like a
right
barbecue.
leg.
So we have burgers.
Okay.
and
It's so
we have
tender.
pork barbecue.
Would you be
Of
okay
course,
doing
my
a
steak,
range of
I have to have
motion
my steak.
test?
And
Okay,
then I have
while
my
I'm here, I'm gonna
Cheetos,
have you press down
and
like a
gravy,
gas
of course.
pedal.
And
Toes
then I
up
also
at
have
the
to
sky.
have, a couple beers. I
Okay.
did quit smoking.
And I'm also gonna check
I did quit smoking
that leg,
about 15 years
both
ago.
legs for edema.
Before
Okay.
before that, I used to
Got
smoke
non-pitting
every day,
edema
and I
to the
started
right
when I
leg,
was really
but
young.
you do have edema noted.
And then
Okay,
what
and I'm gonna have you push
I'm
with your
57, I'm
legs up towards the
retired,
sky.
so-
Perfect, good range of motion. Towards the
When
bed.
we do, we have to walk the
Good,
dog.
good, good.
So we do.
Alright.
So I
Move
do
your
walk
leg
around
up
the
and down
neighborhood
freely.
with my wife, you know, like after dinner
Alright,
sometimes,
one more
depending on the
time.
weather.
Okay.
But usually it's more in
Then
the morning.
hold my fingers, squeeze them as tight as you can. Now pull towards you and pull towards me. There we go. Alright. Then I'm gonna have you lift your arms up and down. Oop, watch the. You okay? Watch the trapeze bar, my friend. Alright, so now I'm also gonna do some reflexes, okay?
And then I'm gonna go ahead and take a look at your eyes.
Alright.
This is part of this.
Okay, here we go. Perfect. Good strong reflexes right there.
I'm gonna check to see if your pupils react to the light, okay?
Alright, good, good. Now we're gonna hold your arm, okay, and just hold it freely. There we go. Nice and loose.
And then I'm gonna
Checking
go ahead
your
and have you follow
reflex
my
here.
inlet here.
Yep. Alright, good strong reflex right there. Alright. So one more time.
Okay.
Perfect. And then we'll check your brachial reflex. Perfect.
And then I'm gonna check
Alright,
your,
good, good. So
smell.
now,
Smell.
reflexes are good. Gonna do the tuning fork right here. Usually we do this if your hearing's not the best on each side, but here we go. You hear that?
Mm-hmm.
My wife doesn't like that I'm growing out my hair.
Which one do you hear the best?
The first one.
And again, which one do you hear the best?
The first one.
Alright, and then next I'm gonna take a look at your hearing.
Alright, do you hear that equally on both sides?
Mm-hmm.
Perfect. Alright,
Yeah, I can hear that.
so
I
now,
don't need hearing aids yet. I can hear
I do gotta look at your ears.
Alright.
So this is an otoscope, okay? What I'm looking at is your eardrum. Make sure it's not red or inflamed or
A
any
little less.
fluid.
A little less. Okay. And
Alright.
this, tell me if you feel.
Yes.
Your your eardrum membrane is
I'm balding,
intact.
that's why.
It's nice
And
and
you
gray and
feel
shiny, the way it's supposed to.
Alright, that was good. Go ahead and stick out your
This,
tongue for me. Say, ah.
This eardrum membrane is also intact, nice gray and shiny.
Good job.
Good.
Can I have you stick your
Alright,
tongue
now
up
I'm
and-
gonna
up and
do
down,
another
up?
test here. We're gonna look at your retina and see the arteries
Can I
in
have you
the
stick your tongue out?
retina. You're
Oh,
gonna
it
see a
makes me
little
laugh 'cause
flashing
my
light,
wife
okay?
laughs
I am
at me
gonna
when
get
that
close
happens
to
when I'm
you
eating
on
ice
this
cream too
one
fast,
to
you
make
know,
sure I
it
can
kind
get
of
a
goes
good
down the
look.
way.
That is
Yes.
okay.
Alright,
Sure.
Check it out.
Uh-huh.
Left and right. Good job.
and again,
And then, can I have you shrug
Okay.
your shoulders for me?
retina is, arteries are intact,
And
no
then can I have
issues
you
with
turn your
that.
head side to side?
Alright. And Mr.
Good, look at
Eugene,
you.
I know.
I got
I mean, I'm
you.
87, but I feel 50.
Have you lay down,
Next, I'm
okay? I
gonna
gotta
look at-
listen
let's
to
look
your
at ears.
vowel sounds and
Make sure everything looks good.
your
What
iliac
I'm
and
looking for is a gray.
aortic arteries.
Sight.
Sure.
Alright, don't fall asleep, okay? Alright.
No worries. I know those can be tricky.
Good turn.
Sure.
Curly.
Okay. Vowel sounds are active in all four quadrants.
Curly. Good.
Let's see. Gonna feel for your
And next, I'm
liver.
gonna take a look at.
Liver is
I just wanna
palpable.
make sure I can see,
Checking for your
it's like an
spleen.
artery.
Your spleen is not
Just making sure I can
palpable,
see
that's
that.
good.
Okay.
Any trouble going to the bathroom? Any constipation?
And my doctor does this
What
too.
about urinary issues? Any issues going,
Personal space,
you know,
okay?
when you go
Alright,
pee?
just look straight ahead.
No.
Okay, no burning or urination, like when urinating.
No.
Alright, now I'm gonna check your aortic artery.
My apologies. I just remember this one time that my
Okay.
my eye doctor, he like tripped, right?
Now
He
moving
fell in
down
front
to
of
your
me.
renal artery.
And I was like, I'm the one that's supposed to be old, right? Because he was a young fellow.
Oh, no.
Do you want me
I have
to
so
listen
many
to your
stories.
femoral arteries?
No, back in the day stories.
Okay, no problem with that.
No, go ahead and
So I will skip that, okay?
blow.
Yes.
Alright.
Right.
Can I put my glasses back on?
Oh, yes, I'm so sorry.
No worries.
And Mr.
Alright, I'm gonna
Eugene, you
take a
can
look
sit
at
up,
your mouth,
okay?
Terrell. I wanna see that everything is nice and pink and moist and
Sure.
Ah,
Alright.
Ah.
that is moist, pink,
That's it.
and tapped. Good job.